Swayam Prabha. Digital India. Educated India.
Hello dear students, today we are going to discuss about semi-solids dosage forms. In general, we will discuss about semi-solid dosage form, and in the coming modules, we will be discussing different semi-solids preparation in detail. And I am Dr. Mona Semalti from HNB Garhwal University, Srinagar Garhwal. So dear students, welcome all of you in this module, and we will move with the solid dosage forms. And after going through from this module, what you will be able to learn, let's see in the next slide in our learning outcome. So these are your learning outcome we will be discussing, and you will come to know about introduction to semi-solids, different types of semi-solid dosage forms and their properties and their merits, demerits, and their important bases which are used in semi-solid dosage forms and their description in detail. So dear students, semi-solid dosage forms, they are applied to the skin or accessible mucous membrane to treat the pathological conditions or it gives you the protection against the harmful environment. Okay, so semi-solids, it may be medicated one containing therapeutic agents, and non-medicated one which are simply just used to give their physical effects as a protectant, lubricant, and emollients. So the non-medicated effect of semi-solid dosage forms are giving lubrication, emolliency, and protectant effect to the skin. Now soluble excipients such as emulsifier, viscosity increasing agents, and antimicrobial agent, antioxidant, stabilizing agents are added to the formulation in any semi-solid dosage form. If we discuss the formula of semi-solid preparation, so there is an emulsifier, viscosity increasing or modifying agents, antimicrobial agents, antioxidants. Okay, so these are the part of the formulation. Semi-solid dosage form, they must be sterile. For example, when it is intended to use on the large open wound. Okay, so it is going in your systemic circulation. So in case of severe injuries like, so it should be sterile. So this is also important factor for solid doses for semi-solid preparations. Now excipients, this should not affect the adversely to the stability of so the selected excipient which we choose for the manufacturing of semi-solid dosage form should be like having such properties that it is not going to interfere with the stability of the final product as well as in its therapeutic activity. Okay, and it also plays a very important role in establishing the compatibility with the other ingredient or other component in the formulation. So excipient, the role of excipients, which is very important for semi-solid dosage form. Now what must be the ideal properties of semi-solid dosage forms? What must be the ideal properties? Okay, fine. Non-gritty, non-greasy, non-staining, non-hygroscopic, smooth texture should have, elegant in appearance, and non-dehydrating. So these are few properties of semi-solid dosage form. And if we add few more properties to it, it should be easily applicable and high aqueous washability and miscible with the skin secretions and having low sensitizing effect. That means it should not cause any kind of allergic reaction to the body. So this is the classification of semi-solid dosage form. It is just like different semi-solid dosage form: cream, liniment, lotions, okay, and different types of creams. So all these are semi-solid dosage form. Now what are the advantages of solid dosage form? Externally applicable, okay, it is applied externally, okay, and less side effect we can say, or less local irritation, or it sometimes it depends, but they are devoid of any kind of allergy. First pass is avoided. First pass or hepatic metabolism is avoided with semisolids because it is applied externally, so we are avoiding complete gastrointestinal tract, and patient compliance is increased, and drug termination is easy, like you can stop it applying at any moment if it causes any allergy. Now moving to disadvantages. Disadvantages of solid dosage forms are there is no dose accuracy in this type of dosage form, because there is not like in other dosage form like tablet or in tablet capsule, or there you take a specific amount of tablet and you decide the frequency of administration. Solid dosage form is just like you take ointment or simply you apply a little amount of cream to the affected area, and the base which is used in the semi-solid dosage form can be easily oxidized, and these are few disadvantages of semi-solid dosage forms. Manufacturing of semi-solids. Now manufacturing of semi-solids, what is the process involved in manufacturing? So the very first step is it should follow the requirement, the manufacturing process basically, it should follow the requirements of GMP practice. Okay, these are few considerations for manufacturing. The information which is intended to provide very broad guidelines concerning the main step to be followed during production indicating are very important for semi-solids. Certain procedures should be validated and monitored by carrying out appropriate in-process control. Okay, and that should be designed to guarantee the effectiveness of each stage, like production and other stages, and limit should be set up for the particle size of active ingredient, which is important, that what particle size is needed for active ingredient, and which should be controlled during production, and particular care should be paid to the environmental condition with respect to the microbial and cross contamination. Now what are the ingredients which are used in the preparation of semi-solid dosage form? Active pharmaceutical ingredient, which is the main ingredient. Okay, bases, preservatives, humectant, antioxidant, emulsifier, gelling agent, permeation enhancers, and buffers. So this is the list of ingredient which we use in semi-solid preparations. Now moving to very important topic, that semi-solid dosage forms, what kind of base is used in manufacturing of semi-solid dosage form. So it is one of the very important ingredient, and ointment and suppository bases do not just act as a carrier of the medicament, but they also have little control on the extent of absorption of medicament incorporated in that, especially with the ointment and the suppository. Okay, they don't just play the role of base there, because they have little role in their absorption of medicaments also. Now, choice of bases, it depends on the several factors. Now, what are these factors? The nature of active ingredient to be incorporated, the availability of ingredient, okay, the shelf life of the finished product, okay, because it is going to decide the shelf life also, and the environmental condition in which the product is intended to be administered. Okay, and one more thing is its stability. Okay, for example, the drug that hydrolyzes rapidly are more stable in hydrophobic environment. And the choice of base also depends on the process which we are adopting in the formulation, and the stability, the transportation also. So the overall integrity of the product depends on the choice of base. Properties of ointment or semi-solid dosage forms. Base. Base is compatibility. Okay, this is very common property which base should have compatibility with the skin pH and the drug. Inert, it should be inert, non-irritating, non-sensitizing, and should be good solvent itself or emulsifying agents. If it is so, it's well and good. And emollient, protective, non-greasy, it should be easily removable, and it should release the medicament easily at the site of administration, and it should contribute in the elegancy of the product, and it should help in maintaining the stability and overall integrity of the any semi-solid preparation. So these are few properties. A property before selecting a good base for semi-solid dosage form, this following property it must have. Okay, and now moving to next, which is a classification of base: oleogenous base, absorption base, emulsion base, and water soluble base. So this is the classification of semi-solid dosage forms bases. Now taking one oleogenous or hydrocarbon base. Okay, they consist of a combination of more than one oleogenous material. Okay, bases means it is a combination of one or two materials such as water insoluble hydrophobic oils or fat, or okay, so it's a combination of this, and they are compatible, occlusive, good emollient itself they are, and they are anhydrous, and they do not absorb water, readily insoluble in water, non-washable. Okay, and Vaseline, hard paraffin, liquid paraffin, white ointment. Okay, so these are bases, oleogenous bases, and they used as a protective, emollient, and vehicle for solid drugs. Second is absorption or emulsified bases. Okay, emulsified bases, they have capacity to absorb the good quantity of water or aqueous solution, and it turns into what? Water in oil emulsion without any change in its consistency. So, okay, they are anhydrous, water soluble, water insoluble, sorry, and water washable they are, and they have good emollient property, occlusive property, and but they do not have good occlusive property, because and the uses are protective, emollient, and vehicle for solution and solid drugs. Next is water soluble bases. So this is third category of bases for semi-solids. Water soluble bases, this includes both hydrous and non-hydrous dermatological non-emulsion bases, which are water soluble and contains no oil phase. Okay, water soluble, water washable, they are non-greasable, and because they soften with the addition of water, the large amount of aqueous solutions are not effectively incorporated into these bases. Next is the role of preservative. Preservative, some bases, although they resist the microbial attack, but there are few which requires antimicrobial in the formulation, because they may attack the prone of microorganisms. So commonly used preservatives for semi-solid preparations are methyl hydroxy benzoate, propyl hydroxy benzoate, chlorocresol, benzoic acid, and phenyl mercuric nitrate. Antioxidants, okay, antioxidants are part of formulation, and oxygen is it is a highly reactive atom basically, and that is capable of becoming potentially damaging molecules sometimes, which are called as free radicals. That we all know that free radicals are quite damaging molecules. Okay? Free radicals are capable of attacking the healthy cells of the body and causing them to lose their structure and functions. So to prevent this, antioxidants are added to the formulation. Okay, so the example of antioxidants are butylated hydroxy anisole and butylated hydroxy toluene. So these are two examples. These are only two examples. So dear students, these are which I mentioned here. But there are several antioxidants which are used in semi-solid dosage form. But just remember these two antioxidant, BHA and BHT. Okay, so this is about antioxidants in semi-solid preparations. Now we will classify antioxidants here. Antioxidants, reducing agents, and antioxidant synergies. So this is the classification of antioxidants, right? So antioxidants can be antioxidants, reducing agents are also antioxidants, and antioxidant synergies. So we'll see them. Antioxidants, they act by reacting with free radicals. For example, BHA, BHT. Okay, so BHA and BHT, BHT which is used for oil system. So these two, BHA and BHT, are examples of antioxidants. Now moving to next classification of antioxidant, which is reducing agent. Now reducing agent, it has lower redox potential than the drug. Hence it gets oxidized first. Ascorbic acid is very common example of reducing agent, and potassium and sodium metabisulfite and thiosulfide, which are basically used for aqueous system. So this is about reducing agents used as antioxidants. So third category is antioxidant synergies. Chelating or sequestrating agents they are, and they enhance the effect of antioxidants. Okay, that's why we call it as synergistic. Okay, citric acid and tartaric acid, these are, and lecithin. So these are example of antioxidant synergies. Gelling agents forms a gel. Gelling agent is one of the formulation additive for semi-solid preparation. It forms the gel. It contributes in forming the gel. Okay, the gelling agent forms gel, dissolves in a liquid phase, so as a colloid mixture, and it forms a weakly cohesive internal structure basically, and there are few hydrocolloids or hydrophilic inorganic substances. They can be used as gelling agent. Trigacant, sodium alginate, pectin, gelatin, and other cellulose derivatives are examples of gelling agent. Alright, so it is not like that all the ingredients are added in all the semi-solid dosage form. Okay, so these which I am discussing here are common ingredients of all semi-solid dosage form. So based on their requirement and their need in the formulation, they are selected. Permeation enhancer. Okay, permeation enhancers are going to help in permeating the ointment or the cream through skin. Okay, so skin acts as a barrier. With the introduction of various permeation enhancers, we can enhance the permeation of semi-solid preparation through skin. So their permeation can be improved by using these agents, which are permeation enhancers. Now moving to emulsifiers. Emulsifiers, because if we take example of creams in semi-solid preparations, so creams are basically emulsions only. So emulsifiers, they are going to reduce the interfacial tension between two liquids, and they are going to help in the formulation of cream. So emulsifiers are also used in the formulation. So anionic, cationic, and non-ionic, we have discussed these emulsifier in the previous modules also, and in cosmetic preparations also. In that entire subject of cosmetics and cosmeceuticals, I have discussed about the emulsifiers, and at many points we have discussed about this emulsifiers. So we will not go in much detail here. Anionic, cationic, and non-ionic, this is the classification of emulsifying agents. Anionic, you can take example. Okay, I request all the dear students to remember this classification and their examples, because you are going to answer them in the emulsion, you are going to answer them in the cream preparation, you are going to answer them in the cosmetic preparations. So you are going to come across these emulsifying agents many of the time. Okay, so you must remember the examples and classification of emulsifying agents: anionic, alkyl sulfates, soaps, sulfonates, okay, and lactylates, and phosphate esters. So these are few examples of anionic, cationic, quaternary ammonium compounds. Non-ionic emulsifiers are alkyl, alkanoalkyl amines, okay, polyoxyethylene, glyceride fatty acid esters, orbiton esters, orbiton fatty acid esters are few examples of non-ionic emulsifiers. Humectants. Okay, this we also discussed in the suppositories also we discussed. So this is also very common ingredient, which is humectant is a hygroscopic substance. Basically it is going to contribute in the hydration, and it will prevent drying out of the skin and formulation. So it is often a molecule with the several hydrophilic groups it has, and most commonly is hydroxyl groups, that is OH group. Humectant, they are used in the semi-solid dosage form formulation to increase the solubility of the active ingredient and to elaborate is permeation. Okay, and it's going to contribute in the hydration. Okay, next is buffer. So buffers are added to various purpose. Such buffers, basically what is the role of buffer? To maintain the pH. If the pH we have to adjust, we have to choose a suitable buffer in any formulation. So compatibility with the skin, drug solubility, drug stability, and influence of and ionization of drug. So sodium acetate, sodium citrate, potassium metabiphosphate. So these are the few examples of the buffers which are used to maintain the pH of vehicle or the pH of the preparation. Purified water, okay, fine. Water for injection, may be used in ophthalmic semi-solid preparation like eye ointment, eye gel, okay, and this preparation must be sterile. I also mentioned it earlier that this preparation must be sterile because ophthalmic preparation must be sterile, should have clarity, should have isotonicity, should have pH balance. Okay, so the water which we are using in the formulation of this preparation must be water for injection, which is or sterile water for injection. Now, what are the other manufacturing considerations? Now, other manufacturing considerations are like organoleptic inspection, evidence of physical stability, which is okay. Now, how to determine that your product is physically stable? Physically stable means it has its complete integrity of the product. Okay, just by noticing few things. Now, what are those few things? Few things are its consistency. The number one is its consistency. Okay, there should not be excessive separation of the liquid or the formulation of agglomerates, and grittiness. When you simply take your ointment and apply, it should not be gritty. Discoloration, emulsion breakdown, because if emulsion is breaking, you can easily make out with your naked eyes, okay, that there is a breakage in the emulsion. Crystal growth, all these things you can make out by just simple physical inspection. Okay, shrinking due to the evaporation of water, right, and the evidence of microbial growth also. So these are few manufacturing consideration that during manufacturing itself, the manufacturing pharmacist comes to know that there is something wrong with the preparation. Okay, so this is the first thing, that is physical instability is one of them. Okay, sterility, preparation is required to be sterile, okay, and should comply with the test for sterility as per standard monograph. Okay, uniform consistency, yes, of course, the ointment should have the uniform consistency, then only it is going to spread uniformly. So this is an important factor. And when the sample is rubbed on the back of the hand, there should not be no solid topical or there should not be any grittiness in the preparation. Should be uniform, should easily spread. So all these manufacturing considerations are important for semi-solid dosage forms. Now moving to the packaging. So dear students, we have discussed many things regarding the semi-solid dosage forms in general in this module. Okay, now we have come to the packaging. Packaging must be adequate enough to protect the formulation from the moisture, light, damage due to handling and transportation. So stability is important. Again here, the use of flexible tubes or the suitable metal tubes is preferred, and preparation for the nasal, vaginal and rectal use should be supplied in the container adapted for the appropriate delivery of the product. So all these factors are important because you will need an applicator to apply the semi-solid dosage form to such areas, and should be supplied with an instructions to be used for the semi-solid dosage forms, right? So this is the packaging aspect. We are not going in much detail about the packaging, then the container closures, and so this I have discussed in my previous modules. So dear student, just go through. If you have gone through from my previous module, I have discussed an entire module on container closures. Okay, so that will form a part of your packaging, right? So here I discussed that only the important thing which has to be considered for packaging of semi-solids. Okay, container, the specific thing about container, it should not adversely affect the quality of the preparation, and it should allow the diffusion of any kind into or across the material of the container into the preparation, right? The container should be fitted with the closure. Okay, this is very common, and it that minimizes the microbial contamination. and should be equipped with a device that reveals whether the container has ever been opened or not. That means the seal of the container, just to make out that the seal is intact. There should be some provision to make the sense that the seal of the ointment or the preparation or the container is intact for the formulation which is packed. Now, labeling requirement. The label should include the name of the pharmaceutical product, the name of the ingredient, okay, the list of the other ingredients which are used in and if an special active ingredients which is used for a special purpose, the quantity should be mentioned, the batch number is mentioned, the expiry date and the manufacturing date and manufacturer's address. So all these things you know already, that what a label should contain for semi-solid dosage forms. Other labeling requirements such as storage condition, name and address of the manufacturer, and name and quantity of the antimicrobial agent which is used. So all these things, and that you have to also mention that the preparation is sterile preparation on the label. And all the topical semi-solid preparations should be kept in well-closed container. The preparation should maintain its pharmaceutical integrity throughout its shelf life. So storage conditions should be clearly mentioned on the product, and the storage temperature should not normally exceed 25 degree centigrade. And if there are certain special storage recommendations or limitations that must be there on the label. So these are the references for semi-solid preparation. So dear students, just go through from the references. Now coming to the summary of this module. So dear students, in this module we discussed about semi-solid dosage form in general, ingredients which are used for semi-solid dosage forms and their role, their importance, and we have discussed them in quite detail, as well as we discussed the different manufacturing consideration for semi-solid dosage form, semi-solid the bases which are used for semi-solid dosage forms and their classifications, their properties, all these things we discussed. Okay, so in coming module we will be discussing about semi-solid preparations. Okay, so we will be discussing creams in semi-solid dosage form. So dear student, that's all for this module, and stay tuned for more videos, and thank you so much for watching this video.